Hey, Usa, it's time
Hey,
for Sambai
Ricky.
Speaks.
It is. I'm so excited for this episode. We
I'm
have,
so excited with our favorite. I'm so excited. We have our wonderful, wonderful doctor. You introduce her because I won't be able to stop.
oh, well, she's known to some as the mother of the breast. To me, she's my Ghanaian mother. To Ricky, sister, friend. I mean, Dr. Beatrice is such a force in Ghana, known as the mother of the breast because she saved so many women through surgery. She's a surgical breast oncologist. And she's joining us from Ghana, Kumasi, her hospital, Peace and Love Hospital. And I will let her share anything else that she would like to say about herself. I mean, there's just so much to say
And some
about
of the,
you.
well,
I need to.
before you even talk, Dr. Beaters, I'm going to read your titles, okay, that are on your email, okay, because they're awesome. All right, consultant breast surgeon, CEO of Peace and Love Hospital, president and founder of Breast Care International, president and founder of BCI America, former member Ethics Committee IARC, chairperson Ghana Cancer Board, medical advisory board member Direct Relief, advisory board member Meals for NCDs, member UICC, executive committee member IBC. And I don't even know what some of these things are, but they sound really profound. Chairperson Ghana NCD Alliance, race chair Susan G. Komen Ghana Race for the Cure, chair BCI Ghana Walk for the Cure. Oh my gosh. Mom, grandma, and just saint in every way. And Dr. Beatrice, when all the survivors, so we just came back from Ghana, Uza and I, and we went to Dr. Beatrice's amazing annual walk. But when we saw all of the survivors on that big field, all dressed in pink, it just hit me. Oh my gosh, you did surgery on all those women. You saved all those women. You saved all those
And I
families.
and I think that wasn't all of them, you
Oh
know.
no, that wasn't all of them. No, no, no. But the ones like, oh
Yeah.
my, it was like,
Yeah.
wow, just how many lives have you touched? So you talk now because you are just an amazing, amazing human. I love you dearly.
We could go on about you forever, so we'll let you
I know,
talk.
I know.
Thank you so much. And thank you for the love. Thank you for the friendship. Thank you for everything. Um, Listening to your introduction, I just feel that it's God working through me. And it's humbling to always see these women who most of them probably wouldn't have been here with us if they had not agreed to go through the treatment, because it's always a challenge in our part of the world for the woman to even decide that, yes, I want to go to the hospital for treatment, because there are always other alternatives that they even normally tell me that the doctors in the house. So after they have come to the hospital to listen to how you are going to work with them through the treatment, they tell you when they go home to meet the doctors in the house, they also tell them different things and they get confused. So we always have to understand where they are coming from, that it's not as though they don't want to survive the disease, but sometimes they become overwhelmed with the challenges in front of them. Most often, it's financial issues. So they don't know what to do. They don't they don't know which option is the best one to pick. And so it becomes too difficult for them to know which options to take. Do I have, do I, can I share and make a presentation, or we can just go like that?
Yeah, you can
Yeah, if you yeah.
Okay. So just a minute whilst I try to pull out a presentation. But the issue with us, I mean, our country, is the fact that a lot of our women report late. And they are reporting late not because they don't want treatment, but because of the fact that breast cancer is not a painful disease. And if the disease is not painful, why should she go to the hospital?
Yeah, that was one of the most profound things I learned when you talked about that, Dr. Beatrice, that if they don't feel pain, they don't go to the hospital. And, like I had triple negative. I had a little tiny tumor the size of a peanut. And of course I felt no pain, but my cancer was in my lymph nodes. I was stage 3A, even at that size, and so I never thought about that before, that just not having pain wouldn't precipitate a visit to the doctor, but that's so
Yeah.
I understand that. I get that now,
I think that is one of our challenges that we have. And our people are used to thinking that once there's no pain, there's no danger. And so going to the hospital has to have a reason. They have to have an important reason why they should go to the hospital. Can you see my screen, please?
Yeah, perfect.
Yes.
Okay. So, because of all those the myths and the misconceptions surrounding the disease, and the fact that they think it's something else, not cancer, because earlier on there was nothing like cancer. They thought that everything surrounding the breast was an abscess. So they would rather go to the traditional way to get some traditional help, either some herbs or some leaves or something. And then when people started dying from it, they then started going to the prayer camps to go and, pray for the healing through miracle. And so we had to start changing the mindset of the people that you can go for prayers, but go to the hospital and let your pastor pray for you. You cannot stop the African woman from going for prayers. We all believe in prayers, but even having a medicine that will help cure your disease is also a miracle. So it all boils down to creating the awareness among the population, improve diagnosis and treatment, advocate for acceptable screening and treatment modalities, because we don't have screening mammography, but we realize we have a lot of nurses, physician assistants. So we could train them on how to use their hands for clinical screening. And we also know that increasing survival rates and reducing the mortality and morbidity reduces the fear and the stigma surrounding the disease.
Yeah. If you can show survivors and give hope with people who survived it and say you don't die,
Yes.
right?
Yes, I always tell them they are the mirror of the disease in our country. And we also needed to establish our own database, because that's something we don't have. We needed to have our own research material and research outcomes. Training of manpower in oncology. We don't have any basic nursing training facility for oncology. If a nurse wants to go into oncology, she has to do it as a postgraduate program to pay attention to women's health. So whilst we are talking about breast cancer, we are also touching cervical cancer, hypertension, diabetes, which mental health, which also affects a lot of women.
Yeah.
Yeah. Again, fundraising to support needy patients and survivors, because a lot of women will be able to survive the disease if they get the help they need.
Yeah.
Yeah. And also engaging in research. to start talking about genetic profiling and bringing AI into the picture, which will only help us to leapfrog, because there are a lot of things that we lack. And if we don't leapfrog, it will take us forever to get closer to the high income societies and what the blueprints are. And so in 2002, we formed the Breast Care International. We all know that cancer is a global problem. And way back, as far as in 2003, WHO came out with the information that cancers are killing more than HIV, AIDS, tuberculosis, and malaria combined. And this was a very strong message, which would have or should have informed our governments to pay more attention to the cancers. It's important that our governments are looking at the infectious diseases because those kill faster. But we are in danger of ignoring the growing burden of cancers in our part of the world. According to Global Can, in Ghana, we record about 27,000 cancers and close to 18,000 die. Our most prevalent cancer is breast, and then we also have cervical, prostate as the more prevalent cancers in the country, and colorectal, liver cancer is also an issue. So we, according to the same WHO, and IAC is the International Agency for Research on Cancers, which is the WHO wing of cancer research, about 70% of cancer deaths occur in the low and middle income countries, and it's expected to rise, to keep growing. In Ghana, we have about 58% of our patients below the age of 50, which means that our patients are young.
Wow.
And if, according to Global Can, 5,026 new cases were diagnosed since 2022, that's the yearly figure. We know that it may be higher than this, but out of this, about 2,300 women die yearly. It's something that we need to definitely do.
Yeah. Gosh.
Up to now, we still don't know the cause of breast cancer. It's not known in America. It's not known in
No,
Europe.
we don't
It's not
know.
known in Africa. Yes. And that, you see, that gives rise to a lot of the misconceptions, because if you don't know the cause of the disease, our people normally want to attribute a disease to something. And witchcraft is the closest they can think of, and spiritual forces. And again, the early signs and symptoms of breast cancer happen to be very bizarre. And so if during our education, we want to focus on the signs and symptoms of breast cancer, and we start talking about peau de range, we start talking about abnormal discharge, dimpling, nipple flattening or retraction, change in the size and shape, we may be asking people to wait for late stage disease. And so we need to always tell people that breast cancer is one of the diseases that we need to screen for instead of sitting down and allowing it to show to us as, let's say, flattening of the nipple or retraction of the nipple, because you need to, all these signs and symptoms appear after a while. So if there's if there's a lesion behind the nipple, for example, it takes time for it to drag the nipple towards it, for the nipple to show as flattening or a retracted nipple. And so screening is very, very important. And to us, teaching women how to do their breast self-examination is very important so that they pay attention to themselves. The woman has to know herself, how her breasts look like and how they feel like, and showing women the anatomy of the breast. Sometimes normal women have no idea what we are talking about. So when we show the sagittal view of the breast and tell women that, okay, you have the duct, you have your rib at the back there, you have some muscles on your chest wall, you have your nipple with some the ducts coming behind the nipple. It gives a sense of understanding of what we are talking about and not just what we see on the chest wall. And so how does the breast cancer start? It starts as a small lesion, which keeps growing if nothing is done about it. So, and one very important feature about cancer is the fact that it can metastasize, it can spread. So for breast cancer, there are some target organs, and these are the liver, the lungs, the brain, and the bones. Now, we need to always show women what the screening methods are, because we are not in America where the woman gets to 40 years and she'll be invited to come and do her mammogram. Here, the woman is just living. And so if we don't approach her and explain to her the fact that you can find breast cancer early and cure it. And if we want them to understand what is normally needed, then we need to talk about the breast self-examination, the yearly clinical breast screening, which is our tool in the presence of screening mammography. And also the use of ultrasound, which I must say that it's not a very specific diagnostic tool. It will show you whether there's a firm lesion or a cystic lesion in the breast. But to be able to categorically say that that lesion is cancer takes a very experienced hands through ultrasound. But mammogram is more specific. And sometimes for women with dense breast, they have to resort to MRI.
Can you talk about, and maybe when you're done even, how you are doing mammograms in Ghana, because it's so amazing how you're sending, I mean, you have a faster result than we have here in the US. Can you talk about that a little bit? And if you're going to get to that, keep going out, whatever.
Okay. So we make sure that we take advantage of the tools, technology that can help us do things better and faster, because most women have to travel from their small towns or villages to the big cities where you have the mammograph machine for them to be able to have a mammogram done. Most of our mammograms are done for diagnostic purposes. And so once you've done the mammogram, you want to know the reports. I mean, what is the mammogram saying?
Right.
And so we send the images to the radiologist, because normally you need two eyes to check the mammogram. So the radiologist can be situated anywhere, whether in Ghana, in Accra or Kumasi, or in the US or in Europe. And since we have access to Dropbox and Google, so we can send the images through these technologies to the radiologists, who quickly read them and send the reports to us through an email. So that is a very quick way that we get our reports.
Amazing. That's amazing.
Yeah, we don't use the films anymore. So now we only use the digital images. Um, Screening mammography normally is done by you know, high class mammograph machines, which are the
Yeah.
digital ones. They are very expensive, but most of our centers do not have the digital mammography machine, but rather the analog, which has been converted into a digital one. And that is one very important tool that helps us to quickly diagnose them. I'll come to the other diagnosis when we get there. So we are looking at such lesions in the film that is produced, the image that the radiologist has to report on. I also want to say that most of breast cancers are in the upper outer quadrant. That's the areas towards the armpit. So women, when they are doing
Yeah, like
their
under here. Yeah,
yes,
right.
yes. When they are doing their own breast self-examination, we want them to pay attention to those areas and also to the axilla because of the lymph nodes. Because whenever there's a lesion in the breast, the first point of call is the axillary lymph nodes. So sometimes a woman will not find anything in the breast, or even through clinical screening, you won't find anything. Your hands will not touch mass in the breast. But when you go to the axilla, you can find a lump there. And when you find that, you need to go to the hospital to check where that lymph node is coming from.
Yeah, because my
So,
cancer was a lump, but it was also in my lymph nodes. I
yes,
feel it in
yes.
my lymph nodes, but it was.
They normally travel through the lymph nodes. So the lymph nodes, those which are the collectors, collect the cancer cells and they enlarge because of the cells. So as we speak, a biopsy is the gold standard for diagnosing breast cancer. We can suspect something through the mammogram. We can suspect something through our clinical breast screening, but we need to do the biopsy to come out with a tissue diagnosis. So we can do the fine needle aspiration. It's something that we don't normally do these days because it doesn't give us a lot of information. It will just tell you that you've seen malignant cells. It's a cytology. But now we do a lot of core biopsy where a bigger needle, maybe a size 16 core needle, is introduced under local anesthesia. So it's not painful. So some of the tissue is collected through the needle and either through the hands, I mean, through palpation, you fix it and you pick the tissue. Or if it's a small lesion, then the biopsy can be done under ultrasound or MRI guided core biopsy. Sometimes we also have to do an incisional biopsy because it can happen that you pick the first biopsy, the report may come as negative when clinically you think that there's something wrong. So you have to go in there and pick a bigger chunk or a bigger sample to give to the pathologist. If it's something on the skin, you use the punch biopsy. And if you have a lesion on the nipple, normally we do the wedge biopsy because some breast cancers start from the nipple. The Paget's disease starts as a nipple rash or a nipple ulcer, and you can diagnose it through a wedge incision of the nipple. There are several subtypes of breast cancer. We normally mention it as a broader disease, as one disease, but there are several subtypes. The ductal carcinoma in situ, which is the stage 0, and then the invasive carcinomas. But the invasive ductal carcinomas are the most common cancers. I mentioned the target organs. So we have the brain, when you can have lesions in the brain, in the bones, when you can have lesions in the bone. We in Ghana tend to see a lot of bone metastasis to the vertebra and not to the longer bones. So a lot of our women who present with stage 4 disease and with bone mets come with paraplegia. That is, they cannot walk because
They
when
cannot
the
walk,
vertebra, when the vertebra collapses, the woman can no more walk. And that's a very unfortunate situation. And normally in October, we tend to receive a lot of women with these conditions. In fact, yesterday in the hospital, I had as many as 6 women in the wheelchair, 6 who had come the first time and had presented with bone metastasis to their vertebra, which
So
is a
they hadn't come to you before. This is their
no,
this
no,
is
no, no. The first time. It's
first
because of
time.
the awareness. Yeah.
Yeah, because they're waiting for pain to happen and they have pain or they
Yes.
can't.
Yes. And also the information that has gone out in October helps to bring them out.
Right, right.
Yes. So
We
we
see
have
so
a
many
lot
more
of,
women in October getting diagnosed too, you
yes,
know?
October, November, a
Yeah.
lot of women come out. Unfortunately, most of them come when it's already too late. We see the lung mets when sometimes they come with fluid in the lungs and you have to rush to aspirate the fluid. Otherwise, the lungs collapse and we can lose hair. Liver metastasis is also a difficult thing to handle. I'm sorry with this, but sometimes we have to say it as it is. And these are the myths and the misconceptions that delay the treatment for our people. The fact that they think it's not curable is by faith, is due to witchcraft, a result of a person's failure or fault, that is a result of a curse on the family.
They
And
blame it on themselves. They blame it on
yes,
themselves.
yes, yes.
Wow.
Because sometimes some people also put that idea in their minds. We've had some women complain that the husband told her that it's because she quarreled with a woman somewhere in the market. That's why she's having the disease. And they think that women die after mastectomy. This was a young lady, 28 years, came when she came with a 2-year-old girl and the breast milk had stopped flowing. She was dressing this herself when the breast had, been eaten off by the disease. And it's very unfortunate when they come in such a late stage.
So the breast had basically eaten, the cancer had eaten the breast away in that situation.
Yes, yes.
Oh my gosh.
This is another one. This one too, the breast had fallen off and it's the bleeding that brought her to the hospital.
God
Our
bless.
people are scared of pain and blood. And so when that happens, and like I said earlier, it's not painful at the beginning. So if there's no bone mets, there's no pain. And so they don't see why they should go to the hospital. But the woman has a lot of barriers to overcome. The lack of awareness is huge, inadequate or bad treatment, especially those in the communities. And most of our women live in the communities, in the rural communities. The cost involved is huge. The distance. And you met the lady who had traveled for
Yeah.
14 hours.
14 hours.
14 hours. Yeah,
Yes.
14 hours. God bless her.
So happening. Yeah. The lack of counseling.
Right.
Because the moment the diagnosis is made, the woman has to receive counseling.
Yeah.
Otherwise, they shut down and it becomes very difficult to get them to even accept treatment. And the lack of support I mean, when you have a husband, you
Right.
know, deserting the family house because the woman has been diagnosed with breast cancer. Poverty is a huge issue, and the fear and the stigma.
So, Dr. Beatrice, at
Yes.
some point, the wife is looking like that to the husband. Doesn't he think something's wrong with her? Like, I mean, does he, I guess there's some, at some point, she's got to look so bad that he's got to be worried about her.
Yes, that's part of the reason why some women, even when they've come to the hospital, default treatment. Because when the woman is taking chemotherapy, obviously she changes, you know. There are some changes that occur. She will lose the hair. She can become darker. And if the husband is not aware, and he wouldn't also come with the woman to the hospital for counseling, he has no idea what is happening to the wife.
Mm.
So some of the women keep their wigs on, they put the head scarf so that the husband will not see the change
Yeah.
that has occurred to them.
Wow. Wow.
But we try as much as possible to invite the husbands to the hospital so that we counsel them. In fact, when the woman is receiving the treatment and she's maybe vomiting or feeling nauseated, she cannot cook for the husband to eat. But we are used to cooking for the husband and the children. In fact, some husbands do not even know how to fry eggs. So even if they know how to do it, they assume that it's the woman's job. It's the woman's responsibility. So they will not support in any way unless we call them to explain things to them that at that time she needs to eat. And you, as the husband, should try and get her something to eat, even if it's buying food from the street for her to get something to eat. So those who follow their wives, they do much, much better.
Mm-hmm.
So we have a lot of approaches. We use the advocacy in the communities, the schools, the churches, various groups and events.
And the walk.
Yeah, the work is one thing. The work for the cure is a very important aspect of our activities. Then also training and capacity building, training nurses and physician assistants, midwives in the communities, in the district hospitals, because they see the patients first. And then training nurse and peer navigators, the young ambassadors for breast cancer. Those are the senior high school girls that we train. Yeah. And training the media who help us in creating the awareness and taking the message out there. Patient support is something that is very, very crucial to us. Because if you go on an outreach and you find a woman in the community and the woman has no money to travel to the city for treatment, then you haven't helped her much. So we try to reach out to those who need help and sometimes have to send Momo to the women in the community to travel to the city for treatment.
Wow.
So
So Dr. Beatrice, in the US, 73% of Black moms are single moms.
Yes.
So less people are married here. So I don't know do you have a number, like are most people married? Do most people have a husband? Because in the States, we see so many single women who are moms of breast cancer, and it's horrible because they don't have a support from a man. You know what I mean? But they do have a circle of women around them usually. But it seems like more women are married in Ghana. I hope so.
I don't have the figures. This is an interesting thing I'll check and share with you. But we also have single mothers. We also have women who are married, but they are just as the same as single mothers.
Single mothers,
Yeah,
yeah.
they end up being single
breadwinner.
mothers,
They
yeah.
bring
Yeah.
food to the
Yeah.
table.
Right, the
So
breadwinner, yeah.
for some of them, the man is not as effective in their lives, but they don't want to leave their marriage
Thank you.
because of social, issues. So that's also a very big issue. And
Yeah.
because of that, they want to please the men to stay because they see marriage as a positive thing.
Security, and love. I mean, it is, right?
It's not security because if you, the woman, are the breadwinner,
Right.
and what is your security about? But
Right.
that social aspect, that social eye that she's divorced or the husband has left her to go and pick another woman.
Right. What will everybody think? Yeah.
Yes, they see that as some stigma of a
Yeah.
sort.
Yeah.
Still stay in it when the man is not doing anything. In fact, yesterday I had a lady, she is 32 with 3 kids, coming with a late-stage disease with the father. So the father was saying that the lady has been running around for more than 1 year looking for money to go to the hospital. So I asked, okay, so where is the man who had the 3 children with her? And the father said, oh, it's even equal to her not being married. You see? But that societal belief or that eye keeps the women in those relationships when they are not
That
getting.
aren't serving them. Yeah.
Yeah.
And it's sad when some of those who are not even responsible are the ones who determine what they want the women to do. That
With their
I don't want
bodies.
you to lose your hair. I don't want
Yeah.
you to receive chemotherapy. I don't want you to undergo mastectomy. And the woman will unfortunately follow this man. So the situation is very different. And that's why I think that in all that we are doing, we are trying to empower women as well. We need to
Yeah.
empower them.
Yes.
For
With education, with knowledge, and with
Yes.
confidence too, you know?
Yes. And let them understand that they have their lives. They entered into their marriage when they were human beings. They had their own heads on their shoulders. And I see my survivors as more empowered women than the women who are not survivors.
Right. Because once once you've had breast cancer, you become a badass, I think.
Yes,
You know,
yes,
I think we
yes.
get stronger and we get more convicted about our health and taking care of ourselves. Yeah. But you hate to have to go through that to get to that point.
Yes. And recently, when one survivor, she's a 10-year-old survivor. In her case, her husband even was against her undergoing mastectomy. And we had to sit her down and talk to her after a while before she could tell the husband that no, she's going ahead with the treatment. And now she's doing very well. She's so empowered. She was telling people that we had a meeting with Kempinski Hotel who brought them food packs. So she was saying that, Kempinski is a very expensive hotel, that she's a survivor. And if breast cancer didn't do anything for her at all, she's managed to eat from Kempinski Hotel.
I love that. I
You
love that.
know, I'll share the video with you. It's very interesting.
I love that.
The women become more empowered after their treatment. Okay, we try to involve all our presidents and past presidents. I think the next time we are in Ghana, we'll go and visit our former president. He's our patron, and he's in the wheelchair now. He was telling me, if not because of the wheelchair, he would have come for the walk.
I love that. But you have so much support from the
Yeah.
government, from the chiefs,
Not
from
government, not
Yeah.
government.
You have
Not the
cultural
government,
support. Yeah.
yeah,
The
but
government comes on board, but they don't support us like
okay,
financially or anything. No. But if you invite them, they come.
okay,
And but we have it's our partners and sponsors who help
yeah,
us. You know,
yeah,
like Direct Relief, Teva, Kempinski Hotel, Delta Airlines,
Delta,
you
yeah,
know, so they help us. Yeah,
yeah,
they help us. And we make sure that the media is always with us. That's why we train them
yeah,
periodically.
yeah, no, that's you have great support there, yeah,
We take advantage of events like the Mother's Day, International Women's Day. So these are the flyers for the breast self-examination that we take the women through and make sure that they also listen to the stories of the survivors. And after that, every woman now wants to be screened. So we do the clinical screening for them. And that's what we've been doing for so many years, looking for such lumps or changes in the breast. I don't think I have to go through all these, the treatment options. This is something that I think is the same that is done everywhere.
yeah,
The
yeah,
counseling, chemo, surgery, radiotherapy, hormone therapy. We do not have immunotherapy though.
right. We need to get that for you.
Yeah, yeah. And also some clinical trials. This is how Joyce came to the hospital. That's her first time in the hospital with this huge tumor. And
Yeah.
now
Look at
she's
her, look at
out.
her.
Yeah.
And she is a badass. She's awesome. But she
Yes.
saved her. You saved her.
Yeah. Yeah.
Saved
And
her.
now the husband who left her is begging her to come back and marry. Yeah.
Really?
And she's saying no.
Wow, God bless her.
Okay, this is also a very bad case, but she's doing well.
I know, look
Through,
at this.
yeah,
We just saw you. Yeah.
we saw her. Yeah, she's doing well. Our youngest patient. That's
13.
Rena. Yeah, she's 19 now after double mastectomy.
God bless her.
Yeah. So it
So when
was
she came to you at 13,
yeah.
that tumor had been there for a while, right?
Yes, it had been there for 2 years. So she had dropped out of school for 2 years. We were fortunate that it had not turned into the malignant phyllodes
Yeah.
tumor. It was an intermediate phyllodes, which meant that it had moved from benign to intermediate, and the next step was to become a malignant one.
Yeah.
Some who had come, a 14-year who came with a malignant one, and she already had lung and liver metastasis at the time she passed. So we were lucky with Reina because we caught her earlier than the
And that
metastasis.
other patient was 14?
Yes, that other
Yeah,
patient
she died,
caught.
and she died.
Yeah, and she died. We actually, phyllodes tumor is considered as a rare type of tumor, but
Yeah.
we tend to see it more often than how the books describe it. So with the pathologists, we are even thinking of doing some research into it. Why do we tend to see more phyllodes tumor than what the literature talks about? So forming the PALSA was very important for us to improve the
Yeah.
quality of life of the survivors and to seek to bring them together. And so they have the association as a family.
Yeah.
And so they have sisters among themselves.
Yeah.
There are some who are sisters-in-law, some have married each other's brothers and all that. So it's a very strong and powerful team that we have. Yeah.
It truly is.
See that you can see that they love each other so much, and they support each other.
Yeah.
Such a good thing. Yeah.
That's very important for us.
Yeah.
So
Survivors need that.
our way forward is to continue to provide education and awareness, clinical screening, counseling, and hope to the communities, especially those in the deprived communities, to provide support and assistance to the poor and vulnerable ones, to bring hope, health, and empowerment, to provide research outcomes which can inform decision making. For example, the role of the environmental pollution in breast cancer development, and the fact that some areas are prone to getting more breast cancer patients, and we see that as something that is linking to the environmental pollution, the illegal mining. To also continuously educate and train our community-based physicians, physician assistants, nurses, midwives, and also establish the standalone comprehensive cancer center of excellence with an AI hub in Ghana. This is when we launched the Lancet Oncology Commission's report, and I'm sure that with time we will be writing some articles which we can present them to the Lancet Oncology and get them published, because we still work with them and we should take advantage of that. Okay, when the team came, we went to our former president. Now, radiotherapy in Ghana, which is an integral part of cancer treatment. We only have 3 radiotherapy machines. We sometimes even say we have 1.5 or maximum 2, because most often some of the machines are not working. And according to IAEA, we are supposed to have 1 radiotherapy machine to 1 million population. We have 35 million. So we are supposed to have 35 radiotherapy machines. So it's something that is very, very crucial. And that's why at the Cancer Center of Excellence, we are thinking of starting with a radiotherapy machine. Because if you've done a breast conserving surgery for a woman, radiotherapy is a must. And if you don't have it, then what do? It means that the patient who probably may have to go and stay in the queue for months will end up coming back with recurrence. And so, yes, so it makes the work very difficult for us. And so looking for getting the needed funding for us to start this is very important. You visited the 52-acre plot of land, which we have now, and we are inviting partners, governments, individuals, and donors to join us to build this future-focused campus that will save lives, inspire innovation, and strengthen healthcare systems. Now, let me quickly touch on our new technology for breast cancer diagnosis, which came out of the project with UC Davis, Professor Richard Levinson as the PI there, Professor Fazad at a PI at Emory, Professor Eric Sabel at University of Washington, and then the Peace and Love Hospital. So what it's saying is we can even now drink wine without a glass. Okay, let's think about it. We can drink wine without having a glass. And what that means is that when we have the core view instruments, or we can call it the Phoebe instrument, which is the first prototype that we have in the world, situated at the Peace and Love Hospital. So when we pick the biopsy, we rinse it, we stain it for a few seconds, and then we put it in the equipment. The equipment generates the image, which is shown on the screen. And this image can be viewed by pathologists in UC Davis, in University of Washington, or wherever the pathologist will be located. Once the pathologist has access to the equipment, he or she can also make a diagnosis. And it takes us 10 minutes to make that diagnosis.
Incredible.
As the conventional way can take us up to 6 months, whilst the woman will be waiting for the results. Imagine the anxiety she goes through, the anxiety the whole family
Oh
goes
my
through.
God.
Yeah.
Right?
And sometimes, after waiting for a long time, they are told that the specimen got lost on the way.
Mm.
So those are things
This
that,
is amazing. This is amazing.
yes. So we believe that the low and middle income countries will benefit from this.
That's an amazing thing. I mean, you get the results faster there than we have in the States.
Yes. So you have the
Amazing.
patient there, you see the
Yeah.
results, and then you can, if it comes positive, you start your counseling and your treatment plan.
Right. Immediately.
Because
That's
you have
right.
to bear in mind that these patients will have to be traveling for hours to go
Right.
and come. And so if we can get the results on the same day, and we are able to do the mammogram on the same day, the scan on the same day, and the biopsy on the same day for the woman.
Phenomenal. That's phenomenal. That doesn't happen here anywhere that I know of.
Yeah, we think that that's one of the
Yeah.
positive parts, that it can be used in the hard to reach areas or facilities who do not have pathologists in the hospital, so
Yeah.
that they also get the reports early. Let me thank Ricky Ferry. I think Uzo is somewhere there.
It's my little hat.
Yes, it
Well,
was so nice.
there you are. There we are. We're in there.
Yes,
And we have our
yes.
shirts on.
And then Tia was also somewhere there. I think she's the one here. Yeah.
Yeah.
Made our day special. And our survivors, who are, I call them my cherished survivors.
They're
And
precious. They're all so precious.
Yeah, yeah. They make our
And the
work.
survivor babies. Oh my gosh. The little girl
Yeah.
that cut the ribbon. I wanted to go take a selfie with her and I could never find her again. I saw her a couple times. I kept trying to find her because she was so cute with her little hairdo, her little outfit, right? She was precious.
Yes. So every year we have the requests for about a minimum of 7 survivor babies who need to go to the senior high school, and because they don't have anybody, so BCI has to come to their aid to support.
Wow.
Yeah. So there's a lot of work here to do.
Yeah, so
And
Dr. Beatrice, so the survivor babies, are they all have all their moms died, or were they
Yeah.
died? They're all died.
they
Yeah.
died.
Gosh. Because I was thinking maybe there were survivor babies of survivor. No.
These ones have their parents, they succumb to the disease. We have some whose parents are alive. We even have some who are professors who are survivor babies, but they do not come to display like that.
Got it.
Yeah. And so where the woman lives should not determine whether she should survive or die from breast cancer.
Right. Wow. 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 Wow.
That together we can defeat breast cancer. That's a cure worth fighting for. Thank you so much.
Oh my goodness. Thank you
This was
so
so
much.
awesome. This was
I
so
mean,
awesome.
you've educated all of our viewers, but also you've like shed light on what the cancer experience looks like from your lens in Ghana. I mean, and the world needs to know, the world needs to see those images that you showed.
Yeah,
And
yeah. And
Thank
we'll put all these links in the chat for the post,
Yes,
you
please. And
know,
also
and to
our
how to donate to the
This Year
hospital.
America.
You know,
This
how
Year
to
America
yeah,
for people to donate, please.
yeah,
Because now we are getting so many patients coming that we need to support.
yeah, yeah.
yeah.
I had
You
so
know,
many questions for you, but you've
Yes.
answered most of them.
I know.
Oh.
Do you have any more? Do you have any others? I know, Dr. Beatrice, every day we get new customers in our business. And we
Yeah.
lose them every day. You know what I mean? It's just rampant. I don't know. We can't stop it. You can't, that you can't do anything except for early detect it. And if you
Yes.
don't know what that looks like and know that to do that, take care of yourself, we're gonna keep getting advanced disease, So your education is awesome. We're happy to help you however we can. And I think that, maybe Sambai will bring some attention to this, to cancer more for us across the world, across the countries that we're doing this research in, and hopefully, maybe even ultimately help change some policy. I think our end goal, our year 5 goal of our part of it, our patient advocacy work of Sambai, is to work on policy and to see if we can get any government changes for screening, for even financial support. So, we'll try hard to do that, but the stories are what tell the story.
Yeah.
Yep.
We have a lot of work to do.
A lot,
And
a lot.
this morning I was on an interview with, we are traveling to the Eastern region next week. And so they decided to have a Zoom interview this morning for almost 2 hours. And
Wow.
so one of the questions was, what can government do presently? And so I think that we cannot start screening mammography. I don't think we are there yet, but at least we can provide mammograph machines in all the regional hospitals.
Yeah.
They are not there. So if a woman is in the northern region and there's no mammograph machine, she has to travel all the way to Kumasi or Accra to go and get a mammogram done, which is, it's something that the government can do.
Can do. Yeah. 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 I know. Somebody asked me, a reporter last week, if I had to pick one thing to act on. I said, screening. I mean, clearly clinical trials would be close there, but screening, because if you can screen, you can do so much. If you can screen early, the screening guidelines, everything about it.
But sometimes the Blacks do not have, we don't take advantage of opportunities that we have.
Right.
I had another call with some Ghanaian groups in Europe and America. And I was asking them, why don't you ladies go for screening? Because you have the mammograph machines there. Some of you have insurances. Those who do not have, you can afford it. But because they are concentrating on work, they don't have time for.
They don't take the time. They don't take the time. Women, women in the States who have good insurance, who have access, and in the States, you can get a mammogram for free if you're over 40. Now that's too late for Black women. I mean, there's still issues around the age, but women don't go. And that's
even for you, right, Ricky? You almost didn't go to your.
I almost didn't go. I delayed my mammogram for 2 months, and that's on my cancer.
Yeah, that's even yours. You did well 2 months.
Yeah.
Joanne was telling us when we went to the interview that she delayed her mammogram for I think 1 year or so.
Yeah, she did say that. You're right.
Yes.
Yeah.
So why?
Why? When you have it, why
we do not have that opportunity.
Right.
And those who have are not utilizing it.
Right.
Women coming from the US, recent one came from UK, running from immunotherapy for her cancer to come to Ghana to come and do prayers and to do herbal treatment. I said, leave my consulting room, go back to UK and go and continue the treatment you started. What kind of thing is this?
Yeah. Yeah.
So
There's so much misleading information.
Yeah.
Yes. We need to continue talking to our people, and women, that's our nature. We don't take important things serious.
Not for
Yeah.
ourselves. Yeah.
No.
We're so
Imagine-
busy taking care of everybody else.
Yes. And who is
Taking
taking
care of
care
the
of us?
Right.
Nobody.
Right.
And so
Nobody.
if we should sit back and think about ourselves, that
Yeah.
you have to be your own advocate.
Yeah. We say be the CEO of your own health. That's what we
Yes.
say, be the CEO of your
You
health.
have-
But that's how we got our tagline that Uza came up with. We are the science we are waiting for.
Yeah.
We are the science we are waiting for. We are, we are and have to be empowered to take care of ourselves and do the science.
Yeah. So we need to continuously talk to our women for that change of mind that needs to
Right.
happen.
Right.
Yeah.
Yeah. And I
Right.
can, it's very clear the work that you've been doing for many years in Ghana. I told you when I was there, you're changing the way that Africa thinks about health. I mean, my dad being from Nigeria, I also shared with you, death is so normalized. I feel like he gets a call about a relative or a friend of somebody that has died. It feels every week he's getting a call. And you've at the point where you stop asking why, what was the cause of death? But being there and seeing all of the media on TV when I'm sitting in the room, you're on TV, but other people are on TV talking
Right.
about Breast Cancer Awareness Month. That's so new
Yeah.
for Africa to just so
Yeah.
openly talk about health. So you are doing,
God's work.
amazing
So you
things.
start out by saying God's work. It's our God job. It's your
That's
God's
it.
work.
Someone had to do it. And there's the saying in our language that it's one person who kills the elephant for the whole village to eat.
Mm.
So there should be one person who has to do something. And maybe I'm that person that God appointed to do
Yes,
it.
you are. You are the golden
I
person.
was
that God
seeing it,
appointed.
I kept seeing it every day, and
Yeah.
it kept sending
Yeah.
some messages to me that you cannot just sit in the consulting room and wait for them to come when it's too late. We need to move. And maybe we won't get the change now in our time, but our children and our grandchildren have to have a better breast cancer future.
Yeah. Yeah. I think that's why God gave me now my fourth granddaughter to save more boobs, right? Than to keep me on my purpose, right?
You don't have a boy yet, right?
I know. We don't have a boy yet, though, to keep me
I
on
think
my purpose.
I'll send some your direction.
I know. No, we can make some marriages happen, right? I'm happy
Yes,
to do
yes.
that. We can make some marriages happen.
I have a lot of
Oh my
boys.
God. You have a lot of boys, yeah. Well, thank you. We love you so much.
Thank you. Thank you for your love. And
Yeah.
thank you for the money you sent, right? I got the information. Thank you. And for the survivors, we actually gave them before they left. And so I told my accountant that Ricky will by all means pay back, so don't worry. And you paid me too. I didn't expect it. Thank
Oh,
you.
no. Of course, well, that's, from our work, it's all the work. But we'll do stuff, we'll post about raising money for the hospital because we have so much work to do. And I'm so excited that we're going to start recruiting for Sambai soon. And as you get new patients, we can bring them into the research, so hopefully we can start that soon. So don't hang up. I'm just going to stop recording. Thank you. See you next time.
Thank you so much.
Back. See you
Thank you.
next
Thank
one.
you so much.
Bye.
Thank you. Bye.